Welcome to Western Perspective. I'm Steve Anderson. The independent inquiry into the tragic death of 7-year-old girl Aishwarya Ashwath at Perth Children's Hospital has been made public this week. The report was handed down on Tuesday, resulting in 30 recommendations that would be accepted and acted on immediately. It was also given to Aishwarya's parents. However, they have slammed the inquiry, claiming that it did not give answers as to what happened when their daughter died. This week, President of Ethnic Communities Council WA, Suresh Rajan, speaks on behalf of the family and what will happen next.
Aishwarya's external panel report was released this week, and it is disappointing from a number of perspectives. The family has had a look at it. I've had a look at it over a considerable number of days over the last few days, and we've had a number of discussions with the family about what it contains and what the outcomes of it are. When we were promised this inquiry going back to May the 14th, the Minister indicated that this panel would look at a couple of aspects of what happened to Aishwarya on the 3rd of April. One, it would look at what happened that night, on the night of the 3rd of April, and what led to her demise. And the second thing it would look at is what systems needed to be changed at the hospital to put us in a position where no other family had to go through what this family had gone through since that time. What the report gave us was a whole lot of information about what the hospital needed to do. The very start, the inquiry was actually established as an inquiry into Perth Children's Hospital and not an inquiry into Aishwarya's death. So it did not address the issues that led to her death. We still do not know categorically that she died of sepsis. We have some information from the coroner's office that indicated that she had organ failure due to fulminant sepsis. That doesn't really tell me whether the nurses attended to her in time, whether the doctors attended to her in time. So that is an issue that we still are looking to get some clarification on. The other aspect of it is that it found that the culture of the organization was particularly disruptive, and also one that was very divided between the staff and the management. Now, my question then remains, why do I need to trust that culture today when nothing has changed? Nothing has changed as far as the management is concerned, and nothing is recommended to change as far as the management is concerned. So now we will actually put an additional 278 staff in there according to what the report says, and they will be managed by the same management that took us from a first world hospital to a third world hospital in 3 years. That function or the culture of the organization is very, very bad, and that needs to change. But why do we have confidence that this management that took us to this position is now going to be able to take us out of it? That is the difficulty that we have with the report. Additionally, the report also said that staffing levels were suboptimal. I'm not sure what suboptimal actually means. Why didn't they just come out and say we had a lack of staff numbers on that night? However, both the Premier and the Minister have indicated that the numbers of staff on that night were perfectly adequate, and they were what would normally have been rostered on as well. So you've gone from a position where the Premier and the Minister are indicating that the staff numbers were okay, and the external panel is saying that the staff numbers were suboptimal. And my question then also goes to the fact that soon after the initial report was released back in May, the Minister announced that there were going to be 19 additional staff in the emergency department. Now, why would you have additional staff allocated there if you're actually going to a position where you say that there was no shortage of staff? So it is a problem. The report did not address the issues that we wanted it to address and what we were promised would be addressed by the external panel. The external panel is made up of about 10 people or so. I was also appointed to that external panel, but they did not know how to use my particular expertise in the area of cultural diversity. What they ended up doing was to use me simply to arrange meetings with the family. And again, that was a function of the fact that the structure of the panel was just inappropriate to deal with the things that they were supposed to deal with. To have a hospital that's in a first world nation and a hospital that's only 3 years old that doesn't have adequate sepsis recognition tools is quite bizarre. The Premier indicated in Parliament yesterday that the level of mortality with people with sepsis is 1 in 6. If that's the case, why didn't they have adequate sepsis recognition tools in a modern, new hospital? And so what we're going to have to see is a significant commitment of money to address some of these issues, but it also indicates that we do need a change of management within the hospital and whatever levels it is that we need to make sure that this will actually be implemented. Whilst the current management is there, we have no confidence that things will change from the structure that they have at the moment, and we have no reason to have that confidence because they haven't done anything up to this point in 3 years that they've had it. Final thing that I want to say in that respect is that the hospital was found not to be dealing with the family with transparency and with adequate compassion, and that is true. That's something that we as the family said right from the very start. However, the hospital has also refused to give us the CCTV footage of what transpired on the night. They were prepared to give that CCTV footage to the internal inquiry panel and to the external inquiry panel, but not to us. That is a lack of transparency. And why are they continuing to behave in that fashion when the chair of the board indicated in her response to the external inquiry report that she was going to change the culture of the organization, so they started to deal with the family with far more transparency and far more accountability. And what she could do is to release the CCTV footage to us, and that would be a good starting point.
And now, here is AMAWA spokesman Dr. Andrew Miller with his weekly COVID-19 update and commentary.
Hi, thanks for your time. Just a reminder as we head towards the opening up of our community more to travellers come January, February next year with very high double vaccination rates, that the third dose of the vaccine is going to be very important for improving sealing and making sure that the long-term effect of these vaccines is adequate to prevent severe disease. So as soon as you're 6 months from the second dose of whichever vaccine you had, very important to get a third dose, which will be the Pfizer vaccine at the moment in Australia. Also, during that time, we must remember there are people for whom the vaccines don't work, and that's actually quite a lot of people. For a start, it's everyone under 12. At the moment, we're really hoping that we'll be following very soon in the footsteps of the US and introducing that for our primary school students. Very important to get that group vaccinated as soon as possible. But there's also all of those people that we know who have disease of one sort or another that affects their immune system, and when you add them all up, that's an awful lot of people that we really care about and that we want to make sure are okay. So we will need to pay attention to breathing clean air. It is an airborne disease, making sure that indoor spaces are well ventilated, and when necessary, when there's disease around, we're still going to need to wear high quality masks in order to prevent the spread and also to avoid large crowds gathering indoors, and places like public transport and so on will have to get used to the idea that we'll be wearing a mask when we're doing those things, as they do in many countries overseas already. We're seeing in Europe, unfortunately, things slipping backwards in many countries because they've just assumed that COVID's finished with now. That's not the case. We are going to need to be very careful going forward. Although we'll enjoy more freedom to travel, we're going to have less freedom within our own community because this disease is still going to be affecting people who we care about a lot. So let's keep that in mind as we move forward, get our schools safe by hopefully vaccinating kids soon, but also getting the ventilation standards much improved and providing PPE for teachers. The other thing that we're going to be needing to take care of is rapid antigen testing. So rapid antigen testing is going to be short turnaround tests that are done on the spot. They're not as accurate, but if you do them regularly, they're very good at picking up if there's active disease around. So take care, be planning, looking forward to those family reunions and so on, which are very important in the future with people in other states, but also being wise and understanding that the pandemic is very much not over yet. Thanks very much for your time.
That's Dr. Andrew Miller, and that's WP for this week. We'll be back next time, but for now, it's back to you, Ivan and Sarah.
Thanks, Steve. And here's Leo with what's coming up on 6 News tonight.
Thanks, guys. And on 6 News breaking news, Victoria's COVID-19 situation continues to ease as large crowds protest once again in opposition to proposed pandemic legislation, as threats are sent to MPs, leading to major concerns for the physical safety of our politicians. Plus, the Prime Minister says he believes he has never told a lie in public life, but is that itself a lie? We'll be fact-checking Scott Morrison on electric vehicles and plenty more. And severe weather hits Victoria with reports of flash flooding just over a fortnight from summer beginning, with roads blocked, trees down, and power outages seen right across the state. You can see full details on those stories and plenty more by going to our YouTube channel. Just search 6 News Australia to find us, or our website 6newsau.com. For now though, guys, it's back to you.
Thanks, Leo. And that's our weekly news and current affairs. We have the latest on our website, wamnnews.com.au.
From Sarah and myself, we wish you good health, good night. See you next Sunday.
Thanks for stopping by.